Thank you so much. It's been a great pleasure for me that being a part of this great platform today, and while hearing my name again and again, that being a parliamentarian, I know it's a great duty of mine as well on the floor, that to represent every Pakistani over there and to help for the legislations and rules and laws to put forward in the House as well. Being a doctor and being a parliamentarian, which have seen the issues of today's social and you can say mental health or public health. In Pakistan, about a country of over 220 million people, social health is a critical aspect of our overall well-being, yet it remains a neglected area as well. Thank you so much for Dr. Justin, who helped us regarding this while he is giving a very good presentation on it from UK. I salute him as well, being a Pakistani. That I think so I get many points on this as well, and being my other participants from Dr. Saiba before me and the another one. Thank you so much, all of you, that they also thought that might Dr. Shaista can help us, and inshallah I will be there to help you guys out. Social health refers to the well-being and quality of the life individuals and communities, encompassing respects beyond physical health, and it includes mental health, social connection, health behaviors, environmental factors, economic security, education, and culture and spiritual well-being. But being a Pakistani, you know that about if you are going to the data points of the poverty of Pakistan is about 39.3% of the population lives below the poverty line, and 18.3% of the population lives in the extreme poverty. And education status is 22.8% of the children of age of 15 of 16 are out of school, and 47.2% of girls of age 15 to 24 are not in education, employment, or training. And if you are going to about the healthcare, then 38.3% of the population has no access to improved sanitation facilities. It's according to WHO. I'm telling you these things because I'm also running in a an NGO with the name of Health to Humanity. I'm working on the health about 10 to 12 years as well. And I'm working with the Save the Children as well before, I think so 9 years ago. And I also did my master's in public health about 3 to 4 years before. So I'm giving these things, that's why, because you people know each other, but I'm the new one here. So I'm telling you these things as well. 21.2% of the population has no access to improved water sources, and about 1 in 5 Pakistanis suffers from mental health disorders, and 50% of mental health patients do not receive even the treatment. And we have also the gender disparities. About women's literacy rate is 47.2% compared to 71.5% for men, and women hold only 20.6% of the even of the parliamentary seats where we are representing in the House. So while we are, I'm highlighting these points because of social health challenges faced by Pakistan, including poverty, limited access to education and healthcare, mental health issues, gender disparities, lack of social protection, and environmental health concerns. But how we can overcome these challenges, there is a before we have also the laws, but the issue is that there is no implementation on it. We are discussing these things, and I think so on many platforms, but we are not implementing these things. But I think so if we are going to have some potential and solutions and initiatives in which education and awareness is very important, healthcare access and equality, and poverty reduction is very important. And then this we are going to take an government initiative is as a SARS program, Benazir Income Support Program. But Benazir Income Support Program, if it is going to Benazir Income Regeneration Program, it's I think so much better. We are investing on it, but we are not getting anything out of it. If I'm wrong, you can people have it. I think so. You people can point out me. But I think so. If we can give a female a place in our society, we can empower her as well by giving it's a good kind of programs in the society. And I think so with gender equality, if I'm going to talk about the national gender policy, women's empowerment program, and we can promote gender equality, increase women participation in education for workforce, and address gender-based violence, I think so. And so the other thing is, while we are talking about the education in our schools, I think so we are going to educate or younger children or females or males as well, or children as well, about sexual, I think so, reproductive health, basically reproductive health. While I'm talking about reproductive health, family planning, if I'm going to discuss, I think so we are very irrelevant on this topic. And I think so this is the main topic to discuss over there. If we are going to give this education in our school and colleges at the early stages, so everybody can know it very well. Even my during my student life, my teacher was once discussing this, and we are feeling ashamed while we are discussing on the sexual and reproductive health, because on the family planning we are discussing. I think so through social media we can help out our children. We can discuss these things while we are giving these ads on the of family planning on anything on the media. We are going to hide ourselves behind. We are feeling ashamed of it. I don't know why. But being a member of the parliamentarian, inshallah, I will raise voice on this as well. That through social media, we can help out our new generation, and we can educate them as well. Well, talking about our mental health government initiatives, that National Mental Health Policy, Mental Health Services Act, increase mental health services, reduce stigma, and promote mental health awareness. Our environmental health could also be discussed over here, as government initiatives about Clean Green Pakistan movement and National Environment Policy, improve waste management, increase access to clean water and sanitation, and promote environmental sustainability. And social protection as well, government initiative social protection strategy, SRS program, and increase social protection coverage, improve social services, and promote social inclusion. While talking about National Health Vision of 2016 to 2025, its aim is to improve healthcare access, quality, and equity. I don't think so we are working on that level. Dr. was telling very good that we are not, this is not a health programs, these are disease programs. I also agree with him. And self-Sahulat program, which provides the health insurance to low-income families. ASAS program, which is the poverty reduction initiative with multiple components, including health, education, and social protection, health, mental policies, clean, green Pakistan, everything. I don't think so. We are the only thing is that we are far behind from the implementation. We are still facing the challenges. We have inadequate healthcare infrastructure, shortage of healthcare professionals, high burden of infectious diseases. Very true about tuberculosis, malaria, typhoid, fever. Even I'm going to tell you that other than infectious diseases, we have the issue of anemia as well in the females. We have high mortality rate. We have these issues because we are not working on these. We have also the BHUs, we have the RHC, we have the district headquarters, tertiary care centers, but we have the lady health workers in our all these structure of health, but still we are far behind. We have growing non-communicable diseases, which we discussed before, diabetes, heart diseases, and cancers. We are not engaging on communities in these things. We have no campaigns. We have no social media interaction with the people. It's really regretting. Poor health education and environment, limited knowledge about healthy practices and disease prevention, and inequitable distribution of resources, disparities in healthcare success and quality between urban and rural areas as well. You know it very well, I think so, all of you. And political instability and corruption is as well, you can say that impact on healthcare policies and resource allocation. But while I think so, we can have also opportunities that the government should take initiatives. We have international partnerships as well, collaborations with global health organizations and donors to support healthcare development. We have growing healthcare workforce, increasing number of medical graduates and healthcare professionals, advances in technology and community engagement. This is the main point, and growing recognition of community involvement in healthcare promotion and disease prevention. We have the public key public health is that maternal and child health, vaccination and immunization, infectious disease control, non-communicable disease prevention, prevention health, mental health, environmental health, health system strengthening. Health system should be strengthened. I think so. This is the main point. And now there is a point that being a parliamentarian, that these facts which I'm discussing with you, and I think so how we can help you. It's the main thing is that we have to pass the legislations which you will provide us, and that's a very good thing that you were saying that the policy makers should be interacted in this case. Right, this is a very good thing that while policymaker is in this, they know very well how we go to have a good legislation in the house. I think so. Am I right in this way? And secondly, UK has helped Pakistan in different ways. I've seen before there are many programs as well. They are helping us in different ways. That is DFIT, British Council, UK, and National Health Services. So these things are very good. If we are going to have a collaboration with them, we can improve our social this public health as well as social health as well. So, whatsoever being a parliamentarian, what you want that I can help you guys, inshallah, I will be there. And we need a certain kind of implementation in the health policies that we have that National Health Vision as well, Sehat Sahulat Program, expanded program on immunization, that is EPI, National Nutrition Survey. We have 2018 guide policies, which responses to the address malnutrition and stunting, and mental health ordinance in 2001, which should be, I think so, revised right now. And tobacco control ordinance is 2022, which aims to reduce tobacco consumption. I think so. There is more things which are going to be discussed for that. Is that if we are going to increase the price of tobacco, then you can help the people, the poor people, that we have the poverty, more poverty in Pakistan. The more smokers are there. If we are going to have the increase the price of the cigarettes, then we can also, I think so, help the people that they are not going to buy these cigarettes, and we have the low rate of this tobacco consumers, and I think so. But we are spending on these the diseases which are outcoming from the smoking. We are spending more on it. So when we are going to have these implementations, then inshallah the outcomes will be very good.